objectives: to explain the difference between superficial and deep veins, to explain the course of major superficial veins of lower limb, and to describe the applied anatomy of superficial veins of lower limb. So starting with the veins of lower limb. The veins of lower limb drain deoxygenated blood and return it to the heart. They can be divided into two groups, that is the deep veins and the superficial veins. The deep veins are located underneath the deep fascia of the lower limb, accompanying the major arteries, whereas the superficial veins are found in the subcutaneous tissue. They eventually drain into the deep veins. You can see the list of superficial and deep veins of lower limb. Among the superficial veins of lower limb are the great saphenous vein, the lesser saphenous vein, or the small saphenous vein, whereas the deep veins include the iliac veins, femoral vein, popliteal vein, and the tibial vein. The deep veins accompany the major arteries and their branches are usually paired. They are located within the vascular sheath with the corresponding artery, which helps compress and move blood with the veins. Both type of veins, either they are deep or superficial, they have venous valves to prevent reflux of blood distally, but they are more numerous in the deeper veins. Although the valves are present in both veins, that is the deep vein and superficial veins, but they are more frequent, they are more in number in the deep veins as compared to the superficial veins. They also contain tributaries. So, in short, in the lower limb, venous blood flows from the skin to the superficial veins, and from the superficial vein, the blood is then drained into the deep veins. With the veins, there are valves that prevent backflow of blood. So coming to our topic, that is the superficial veins of lower limb. Superficial vein, as we have discussed before, they run in the subcutaneous tissue and then they drain into the deep veins. Now, when we talk about the lower limb, there are two major superficial veins, that is the great saphenous vein and the small saphenous vein. The great saphenous vein, also referred to as the long saphenous vein, and is the longest vein in the human body. It is a continuation of medial marginal vein of the foot and ends in the femoral vein distal to the inguinal ligament. So the great saphenous vein, which is the largest vein of the body, it originates from it is basically the continuation of the medial marginal vein and it ends up in the femoral vein. Now, a brief description of regarding its course. We have discussed that from where does it originate? It originates from the medial marginal vein and it end up in the femoral vein. But in between the medial marginal vein and the femoral vein, what is its course? So we'll discuss a little bit on its course. It is formed by the dorsal venous arch. Now you can see in the figure that the dorsal venous arch, this is the dorsal venous arch, the dorsal venous arch form the great saphenous or the long saphenous vein. So the dorsal venous arch and the dorsal vein of the great toe. You can see the big toe. This is the dorsal vein of the big toe and the dorsal venous arch. It forms the great saphenous vein. Then as it forms, it ascends up medially on the medial side of the leg. The thing you have to remember that the great saphenous vein ascends medially. Please do remember it. then passing anterior to the medial malleolus. This is the medial malleolus, and the great saphenous vein is running anterior to the medial malleolus. The great saphenous vein formed by the dorsal venous arch of foot and the dorsal vein of the great toe. Then it ascends anteriorly anteriorly of the medial malleolus, and it runs medially. Then posterior to the medial condyle of the knee. See, this is the medial epicondyle of the knee, and at the level of medial epicondyle, it becomes posterior. So the great saphenous vein, which is running medially throughout its course, become posterior, come to lie posterior at the level of medial condyle of the knee. I again repeated that the great saphenous vein, which have been formed by the dorsal venous arch of the foot and the dorsal vein of the great toe. It ascends up on the medial side of the leg. It passes anterior to the medial malleolus, but at the level of medial epicondyle, it becomes posterior. As the vein moves up now, upper than the medial epicondyle of knee. So as the vein moves up the leg, it receives tributaries from the small superficial vein. Now you can see several tributaries coming in the great saphenous vein. It terminates by draining into the femoral vein immediately inferior to the inguinal ligament. This is the inguinal ligament, and immediately inferior to the inguinal ligament, the great saphenous vein drains into the femoral vein. So, the great saphenous vein, which have been formed by the dorsal venous arch of foot and by the dorsal vein of great toe, it moves up medially, and at the level of medial malleolus, it is basically anterior to the medial malleolus. Then it ascends upward medially, but at the level of medial epicondyle of knee, it becomes posterior. As it ascends upward, it receives several tributaries from the small saphenous vein, and finally, at the level just below the inguinal ligament, it drains into the femoral vein. Tributaries of the great saphenous vein. There are several tributaries of the great saphenous vein. Number one is the posteromedial vein of the thigh. Yeah, now you can see the posteromedial vein of the thigh. It drains the superficial aspect of the posteromedial region of the thigh. Then we have anterior femoral cutaneous vein. It is a continuation of the anterior veins in the distal thigh. It crosses the femoral triangle before opening into the long saphenous vein. Then we have the third vein, which is the tributary of the long saphenous vein, which is the superficial epigastric vein. If you could see in the picture, the superficial epigastric vein. It drains the inferior abdominal wall and opens into the long saphenous vein as it passes the saphenous opening. Now you should have an idea that where that the as the tri depending on the location of the vein is draining only that portion of the or that area of the structure. Then we have superficial circumflex iliac vein. It drains the inferior abdominal wall and opens into the long saphenous vein as it passes through the saphenous opening. Then we have superficial external pudendal vein. It drains part of scrotum or labia. Then we have deep external pudendal vein. Also joins the long saphenous vein at the saphenous opening. So, if I take a quick review regarding the great saphenous vein, we can say that the great saphenous vein is among the two superficial veins of the lower limb. Then great saphenous vein is formed by the dorsal venous arch of foot and by dorsal vein of big toe. It ascends upward medially, crosses the medial malleolus by passing through it anteriorly, but at the level of medial epicondyle of knee, it comes to lie posteriorly, and it finally ends up just below the inguinal ligament into the femoral vein. There are several tributaries of the long saphenous or the great saphenous vein. Among them, the first one would be the posteromedial vein of the thigh, which actually drains the posteromedial region of the thigh. The as the name of the vein indicates the region where it is draining. Anterior femoral cutaneous vein drains it crosses the femoral triangle and before opening into the long saphenous vein, and it is actually the continuation of the anterior veins in the distal thigh. Then we have superficial epigastric vein. Superficial epigastric veins drains the inferior abdominal wall and opens into the long saphenous vein as it traverses the saphenous opening. Then we have superficial circumflex iliac vein. It drains the inferior abdominal wall and opens into the long saphenous vein as it passes through the saphenous opening. Then we have superficial external pudendal vein. It drains part of the scrotum or labia. And finally, we have deep external pudendal vein. It also joins the long saphenous vein at the saphenous opening. So there are a couple of veins which are joining the long saphenous vein at the level of saphenous opening. So this is all about the long saphenous vein. Then we'll come to the other vein, that is the small saphenous vein. The small saphenous vein, it is formed by the dorsal venous arch of the foot and the dorsal vein of the little toe. See, the dorsal venous arch of the foot and the dorsal veins of the little toe, whereas the great saphenous vein have been formed by the dorsal venous arch of foot and the dorsal vein of the big toe, whereas the small saphenous vein is formed by the dorsal venous arch of foot and the dorsal vein of the little toe. Then it moves up on the posterior side of the leg. See, the short saphenous vein or the small saphenous vein, it moves up on the posterior side of the leg, whereas the great saphenous vein moves up or ascends on the medial side of the leg, then passing posteriorly to the lateral malleolus. Now you can see the lateral malleolus, the small saphenous vein passes posterior to the lateral malleolus along the lateral border of the calcaneal tendon, moves between the two heads of the gastrocnemius. You can see that it moves between the two heads of the gastrocnemius, and finally it drains into the popliteal vein. So the small saphenous vein which have been formed by the dorsal venous arch of foot and the dorsal vein of the little toe passes posteriorly or ascends posteriorly in the leg. It crosses the lateral malleolus by passing posterior to the lateral malleolus, and as it ascends it passes between the two heads of the gastrocnemius, and finally it drains into the popliteal vein in the popliteal fossa. There are two tributaries of the small saphenous vein. They are the deep veins of the dorsum of foot and the cutaneous veins of the leg. So, coming to the clinical of the superficial veins of lower limb, among them the most common is the varicose veins. Varicose veins are common in the long saphenous vein and its tributaries and appear due to venous insufficiency. Occurs when the valves become incompetent, resulting in retrograde flow of blood within the veins. This results in dilated and tortuous veins. You can see the dilated and the you can see the dilation and the tortuous veins. The symptoms include tenderness, exercise intolerance, edema, and pruritus, which is also called as itching. Treatment involves injection of a sclerosing agent which breaks down the endothelial wall of the vein. Following treatment and for prevention of further varicose veins, compression stockings are recommended. So basically, compression stockings are the lifelong treatment of the varicose vein apart from the injections. Then we have another clinical, that is grafting for bypass. The long saphenous vein is commonly harvested in order to bypass an obstructed coronary artery. The bypass surgery is referred to as a coronary artery bypass, and once harvested, the vein is referred to as a graft. It is commonly used as it is easily accessible and its removal is not problematic due to other collateral circulations in the lower limb. Before the vein is used as a bypass, it is reversed so the valves do not occlude blood flow in the graft. So this is all about the superficial veins of the lower limb.